on November 9th for debate 2, which is actually debate 7 in your category. This House would keep the mentally ill from guns. Well, of course you would. No, not really. So it's a debatable question. So let's hear why it's debatable from Armand Salehi and Elizabeth Wilcox. Right? Rock and roll,
Hi
sir.
everybody, my name is Armand.
Hi, Armand.
The resolution for today's debate is this House would keep the mentally ill from guns. This proposition is to be presented as a policy case in the affirmative. If I can prove that the mentally ill are causing more harm than good by possessing a gun, then I have won this debate. The definition set forth for this debate, this House is defined as the United States federal government, and mentally ill is any signs and symptoms that cause frequent stress and affect an individual's ability to function. Now, going on, what is the problem? There are more mass shootings in the United States than in any other country. According to the Gun Violence Archive, a mass shooting is defined as any incident in which a gunman shoots or kills 4 or more people in the same general time and location. By that definition, in 2017 alone, we have seen 307 mass shootings in the United States. Most of these mass shootings are led by individuals who have a history of mental health issues, which I will further explain later. Now, how big is the problem? From research conducted by CNN, the 3 deadliest shootings in the US have occurred in the last year and a half. These 3 include the recent Las Vegas massacre, which left 58 people dead, the Orlando nightclub shooting, which left 49 dead, and the Sutherland Springs church extermination in Texas just a few days ago, which left 26 people dead. I am going to repeat this statistic one more time because it's unbelievable. 307 mass shootings have occurred since January 1st of this year. Each of these mass shootings had to have at least 4 people killed based on the definition from the Gun Violence Archive. Now, listen closely. Let's just say, as an example, that exactly 4 people died in each of these 307 mass shootings. 307 multiplied by 4 is 1,228 people. To give you a better understanding of how many people we're talking about, this is a screenshot from my Facebook today. My friends list is at 1,121. So it's ridiculous to think that in less than a year, someone's entire list of friends on Facebook could be shot dead. It's ridiculous and uncalled for. As you may have already deduced, not every shooting is covered on national television. We have to keep reminding ourselves that we have mass shootings in California too. Just last night on November 8th, NBC local news reported that 4 people were shot and sent to the hospital and are in critical condition. That happened right here in downtown LA, not too far from where I'm standing now. Why do we have this problem? Individuals who are mentally ill with a will to kill have easy access to firearms. You may ask, there's so many background checks people have to go through in acquiring a gun, but according to The Economist, private individuals can buy and sell guns without any checks on the criminal or mental health records of buyers. Almost 40% of gun sales currently fall through that loophole. The same article also mentioned that states are lazy about reporting the adjudication of these mentally ill individuals to the federal government. In turn, NRA databases will show a clean record when it comes to mental health examination for that individual wanting to purchase a gun. Individuals who are classified as psychotic patients are not being treated early enough due to a lack of care and funding. To move on to my next point. According to the Treatment Advocacy Center in a research article published in June of 2016, quote, most of the offenders were not being treated for their illness at the time of the crime, leading to conclude that closer follow-ups of psychotic patients, especially schizophrenics, could do a lot to improve the welfare of the patient and the community. The same research article also stated that the US and international to-date research suggests that individuals with schizophrenia and bipolar disorder are responsible for almost 33% of mass killings since 1966. This statistic strictly represents individuals with schizophrenia and bipolar disorder, no other mental health case. tying in the most recent mass shootings, proving why mental illness is the reason behind thousands of innocent lives lost. And I want you guys to make sure you're paying attention because this is where I hit it home. 1. Stephen Paddock, the shooter of the Las Vegas massacre, was prescribed Valium. Valium is a drug used for mental illnesses such as anxiousness and panic attacks. Police found a prescription bottle of Valium on the hotel room floor where he was shooting. The doctor who prescribed him the Valium did not comment on the issue. 2. Omar Mateen, the shooter of the Orlando nightclub shooting, was, quote, not a stable person, according to his ex-wife, Satora Yusufi, reported by the Washington Post. Omar would come home and start beating and abusing his ex-wife for no reason, which eventually led to their divorce. 3. Devin Kelly, the perpetrator of the most recent mass shooting at a church in a small town of Texas, was accused of the worst mass murder in Texas history. Devin escaped a mental health hospital after making death threats in 2012 while in the Air Force. He had fractured his baby stepson's skull by stepping on him intentionally and assaulted his wife. Now, Stephen Paddock, Omar Mateen, and Devin Kelly, who were responsible for the 3 deadliest shootings that have occurred in the past year and a half, have all had a history of mental illness. What is the solution, and will the solution work? My solution is to ban private sales of firearms, 2, audit individual states to ensure they are reporting mental health records to the federal government, 3, increase healthcare funding to support free follow-up examinations for psychotic patients, 4, any individual who wants to purchase a firearm shall have a mental health examination performed by a licensed professional before purchasing the weapon. In conclusion, we can save so many innocent lives by simply imposing these stricter policies. Thank you very much.
Okay, I stand open for cross-examination and points of clarification. Go.
Okay, so you mentioned that Paddock and some of the other people were prescribed Valium, but if it's being treated for anxiety and depression, does that mean that every single person in America who has anxiety or depression should be restricted from owning a gun?
No, Valium is a prescription medication that is treated for higher cases and more intense cases of anxiety and specifically panic attacks, people who can't control these issues.
So does that mean that people who have panic attacks are more prone to committing crimes?
And that's up to the solution that I proposed, where a medical professional would have to examine these individuals to determine whether these individuals are fit to possess a gun or not.
But how could someone just, I assume that the examination won't be very long, can't they just pretend that they're perfectly normal?
That's your assumption. The examination will be very thorough because we want to ensure the safety of our innocent civilians.
Okay, and also, how can you say that it's caused by them being mentally ill? Couldn't they just be so-called bad people who just hurt people?
In the last year and a half, the 3 deadliest massacres in America were 100% caused by people who are mentally ill.
No, great. Thank you very much. Okay, let's hear from your constructive speech now. Thank you so much. Okay, begin.
I'm Elizabeth.
Hi, Elizabeth.
This proposition will be presented as a policy case in the negative stance. The criteria for assessing truth will be a preponderance of evidence and quality of evidence in favor of a proposition. All sources are from 2014 or later unless otherwise noted. Mentally ill. According to the Oxford English Dictionary, mental illness is described as a condition which causes serious abnormality in a person's thinking or behavior, a psychiatric illness. It also warns that this term is considered outdated and potentially offensive. What's the problem? According to Lois Beckett, in an interview with Dr. Jeffrey Swanson, a leading researcher on gun violence and mental health, people with mental illness only contribute 4% to the total number of violent crimes committed. On the other hand, looking at a study of male mass murderers, as Swanson details, 70% were described as a loner, 61.5% had problems with substance abuse, 48% had preoccupation with weapons, 43.5% had been victims of bullying. Only 23% had any documented mental health history. In terms of suicide, mental illness plays a much bigger role, according to Swanson, as approximately 47 to 74% of suicides are directly caused by mental illness. How big's the problem? As Matthew Goldenberg wrote in the New York Times, there are nearly 13 million people in this country suffering from severe mental illness. Which of these should be targeted for restrictions? As Robert Pear details, a now repealed measure from 2016 tasks the Social Security Administration with providing information on approximately 75,000 people each year who have a documented mental health issue, receive disability benefits, and are unable to manage these benefits because of their mental impairment, or who have been found by a state or local government to be legally incompetent. But according to Joshua Horowitz from the Consortium for Risk-Based Firearm Policy, while mental health practitioners play a role in the decision, it is mainly made by a claims representative with 13 weeks of training and no medical authority. Why do we have the problem? Gun proponents want you to focus on mental health legislature because, as Tennessee Republican State Senator Ron Ramsey says, it leaves law-abiding gun owners free to exercise his God-given constitutional right. And as Matthew Gamson wrote, the NRA blames gun violence on mentally deranged people and uses it as a political tool to turn public opinion away from gun control towards mental health legislation. Highly publicized news accounts paint a picture, according to M. Roxana Nothus Rudolph, of mentally ill people being inclined toward violence and encourage legislation that is misguided and discriminatory and grounded in emotions rather than statistics. So what's the solution? Risk assessment evaluation. According to Rudolph, we need to use a risk assessment evaluation that targets specific factors which identify actual threats, regardless of whether they are made by someone who is mentally ill. First, she proposes redefining dangerous behavior to behavior capable and likely to cause harm, including verbally and non-verbally communicated threats to inflict injury on oneself or another. She further lists the 5 variables that should be monitored, which include a history of violent behavior, a history of substance abuse, recent civil commitment, a history of criminal activity, and a history of refusing recommended treatment for severe mental illness. Gun restraining orders. Swanson proposes removing guns temporarily from people at high risk for harming themselves or others in a manner similar to a domestic violence restraining order. Will the solution work? According to Swanson and Norco, in 1999, following a highly publicized mass shooting, Connecticut became the first state to pass a law authorizing police to temporarily remove guns from individuals when there is probable cause to believe that a person poses a risk of imminent personal injury to himself, herself, or any other individual. They estimated that for every 10 to 11 guns that were removed, 1 suicide was averted. Unfortunately, the law is not widely implemented due to issues with police staffing. Even so, the law has a potential to catch dangerous people even without a criminal or mental health record. What are the advantages? Mentally ill people are not singled out or discriminated against, preventing them from seeking treatment. People without a mental health record or criminal record can be assessed for risk and have their guns removed temporarily. The rates of suicide will go down since gun-related suicide attempts are almost always fatal. On balance, what outweighs? The fear for public safety connected to firearm death is far broader than just mentally ill people. Explicitly targeting mentally ill people isn't just discriminatory, it also leaves out many people even more likely to commit gun violence. A practical risk assessment-based policy is a gun solution we need. I now stand open for cross-examination and points of clarification.
Excellent. Thank you, Elizabeth. Okay, let's have the cross-examination. I'm going to have to change the battery before